Hello everyone, welcome back to our channel Nursing Career Club. Today we will start Home Health Ed Unit 5 Nutrition and Hydration. Introduction. Eating a balanced diet provides the foundations for good well-being, physical and mental health. Our bodies and minds need to receive the right fuel to perform at their best. It means that we should take nutritious and balanced diet so that we can keep our body and mind in a good condition. In the same way, our physical and mental health will also be implemented. Definition. Nutrition and hydration are the intake of food and fluid to meet dietary and biological needs. Good nutrition is fundamental to well being. Nutrition refers to the study of how food affects the body and provides the necessary nutrients for growth, maintenance, and repair. It involves the consumption of various types of food, such as carbohydrates, proteins, fats, vitamins, and minerals, in the right amounts and balance to support a healthy lifestyle. Good is essential for overall health, physical and mental well-being, and the prevention of chronic diseases. It also involves understanding how dietary choices and habits can impact health outcomes and the importance of making informed choices. Significance of proper dietary intake, nutrient provision. We can say that we should take nutritious food to keep our body and mind in a good situation. We take carbohydrate, protein, and fat in the full amount. Second one is energy balance. Balanced state, positive energy balance, negative energy balance. So we take food in a proper quantity in so that we can get good amount of calorie in our body. Significance of proper dietary intake. Third one is disease prevention. We can prevent diseases by taking nutritious food and proper amount of good good food for our good health, healthy growth and development of a healthy child. A child can be do a child's health can be grown by good nutritious food and a good habits of eating food. Good mental health tips. Stay in touch with your support group, eat healthy, get adequate sleep, cut down on alcohol and other substances, exercise, seek professional help. Sixth one is enhanced athletic performance. We should perform athletic performance. It means that we should play athletic games to keep our body fit and our mind also in a good condition. Improved immune function. If we take nutritious food and our mind and body will be in a good condition, then our immunity power will also be increased. So we need to improve our immunity function. Eighth one is longevity and quality of life. Longevity is about quality of life, not quantity. It's not how long you live for, it's about how you feel each day. The various components of food. Carbohydrates. Carbohydrates are found in various foods, and we talk about fats. We can also say fats as lipids. Lipids, commonly referred to as fats, are substances of biological origin soluble in organic solvents such as chloroform and menthol. Fats, oils, certain vitamins and hormones, and most non-protein membrane components are lipids. Third one is proteins. Proteins are essential components of living organism, including humans. They are complex molecules made up for smaller and units called amino acids. Proteins have diverse functions in the body, such as supporting growth and repair of tissues, regulating chemical reactions, and aiding in the transportation of molecules. Vitamins. Vitamins are also found in our food in our food. There are various types of vitamins. Vi- Vitamin A, B1, B2, B3, B5, B6, B7, B9, B12, vitamin C, D, E, K. These are the types of vitamins. Minerals. Minerals such as iron and copper and any other mineral. Like a mineral is a naturally occurring inorganic solid with a defined crystal structure and chemical composition. Occurs in nature. Inorganic solid has a chemical formula, has a crystal structure. Water. Water is very necessary for the living organisms like humans and also animals. We need a proper quantity of water to keep our body in a healthy situation. Solid diet. Solid diet, like we take various fruits and various food components that are related to solid diet. Second one is semi solid diet. Third is liquid diet. Liquid diet means the drinking drinking diet. Water, coffee and tea, broth, popsicles and gelatin, sports drinks, lemonade. These all are the components of liquid diet. Soft diet. Our meal is included in soft diet. Various precautions to be taken while feeding the patient. First one is positioning. Positioning is very important part for the growth of our body parts. So we should do positioning in the accordance of doctors and nurses. Assessment. Preliminary assessment. Doctor's order. Identify the patient, general condition of patient, articles available in the unit. Preparation. We should be prepared physically and mentally well, and we should take nutritious food and minerals and vitamins so that our mind will be in a proper condition and our body will also be in a good condition. Fourth one is supervision. There are four criteria of supervision: dedicated staff education, positive workplace culture, clinical supervisor support, clinical supervision. Now, fifth one is safety. Wear safety harness when working at heights, use personal protective equipment, report unsafe work condition to your supervisor, drink more water. Communication. There are two types of communication: verbal communication and non verbal communication. And apart from this, there are visual communication and written communication, listening communication. Seventh one is observation. We should observe the things which are surrounded by us. We should also observe our environment on the daily basis. Documentation. Documentation is a mandatory thing Documents are prepared when a patient goes to the doctor, then the doctor prepares documents and the vital signs. So documentation is a mandatory thing. Facial expressions. There are several facial expressions: happiness, sadness, anger, fear, disgust, confused, contempt, thoughtful, shy, funny, surprised, excited. Body language. Body language is such a thing, how we talk to each other and how we express our ideas against a crowd, and what types what type of our attitude. These things are included in body language, like gesture, communication, signs, facial move, posture, movement, expression. Changes in breathing pattern. Now we will talk about our breathing pattern. Normal breathing, breath holding, deep sigh, hyperventilation, normal breathing. Physical signs, emotional signs of disordered eating, extreme preoccupation with weight, calories, dieting, and carbohydrates. Fixation with body image, size, or shape, a specific body part and weight. Specific food rituals, withdrawal from social eating activities, significantly limiting the variety of foods consumed. Now we will talk about hand hygiene. There are many types of hand hygiene by which we wash our hands. Soap and water, palm to palm, between fingers, back of hands, thumbs, back of fingers, fingernails, wrists. Food handling, safe food handling. Principles of safe food handling: temperature control, procedure for using your probe thermometer, cross contamination, prevention of cross contamination, personal hygiene, cleaning and sanitizing. These are the components of food handling. Oral hygiene. There are 8 steps for healthy teeth, healthy diet, regular visiting to the dentist, clean your tongue, vitamins, use dental floss, no smoking, correct toothbrush and toothpaste, do not drink very hot drinks. Positioning. Earlier we have talked about positioning. There are several position ways of positioning. We should do positioning in the accordance of a doctor and nurses. The principle of hygiene while assisting patient in feeding and drinking. Assistance with feeding. We should assist the patient while the patient is eating food, and we also should help the patient to move from one place to another place. Sixth one is monitoring and observing. Continuously improve, define clear performance and availability targets, monitor the system end to end, implement distributed tracing, monitor the performance of individual components, visualize your data, enable log analysis and searching, use alerts and notifications wisely, monitor your monitoring, use a variety of monitoring tools and techniques. Seventh one is environmental hygiene. Now we will talk about environmental hygiene. Risk identification, classification, monitoring of areas, classification or monitoring of zones, establishment, monitoring of sampling plan. Fifth is sampling, analysis of results, implementation of actions plans if necessary. These are the several parts of environmental hygiene. Now we will talk about personal protective equipment. There are many personal protective equipments such as head cap, face guard, disposal bag, scarf, scratch resultant goggle with antiseptic lens, anti-static lens, three-ply mask, hand gloves, long shoe cover. The importance of intake and output record. First one is assessment of fluid status. Assessment of fluid status. History, examination, vital signs, mucous membranes, skin turgor, capillary refill, chest oscillation, neck vein examination, CVP, UOP. Investigations, CBC, LFTs, RFTs, urine, FENA, urine NA, both decrease with hypovolemia. D others, ECHO, IVC, diameter, PA catheter. Now we will talk about detection of fluid imbalances. There are several types of detection of fluid imbalances. Excessive sweating, persistent diarrhea or vomiting, hyperglycemia, dehydration, burns, vitamin deficiencies. The most common cause of water and electrolyte disturbance. These are all about the detection of fluid imbalances. The importance of intake and output record. Management of medical conditions. Regular medical checkups, work and leisure balance, targeted exercises, sleep hygiene, financial support, social support, healthy habits, stress management, healthy eating behaviors, patient education. Now we will talk about patient safety. 8 ways to be a safe patient. Keep hands clean, be antibiotics aware, never reuse needles, syringes, speak with questions and concerns, know the signs of infection, stay up to date of vaccines, act fast if you suspect sepsis, cover your cough and sneeze. These are the types of patient safety. Fifth one is prevention of complications. Prevention or correction of tube feeding complications, clogged feeding tube, possible causes, formula too thick for tube medications, preventive corrective measures, select appropriate tube size, dilute formula with water, flush tubing with water before and after giving formula. Documentation and communication. We have earlier talked about documentation and also about communication. So, documentation is the mandatory part in the treatment of a patient, and communication, we can say that there is a communication between a doctor and a patient. Now, the importance of intake and output record. In biology, input and output is the measures of food and fluids that enter and exit the body. Certain patients with the need are placed on I and O, and if so, their urinary output is measured. Thank you all for watching our video. If you want to ask a question, then you can comment in our comment section. And if you want to take our notes, then you can visit on our official website www.nursingcareerclub.com. Now we will see you in the next video.